primary area that our research addresses relates broadly to obesity and the related metabolic diseases. For example, some researchers would test different lifestyle interventions in clinical settings to determine which ones would be more effective in reducing obesity, while basic science researchers would identify the specific mechanisms by which dietary compounds and nutrients affect various cells that can contribute to obesity, such as liver cells or fat cells or muscle cells. Basic science information that is generated through obesity research is going to help understand the science-based evidence for the beneficial effect of certain diets or certain foods or nutrients. However, at the community or at the clinical level, this information can be used to educate the population that is served in terms of how to apply this knowledge and educate them about this information, but also at the same time helping the population choose the proper diets and the proper foods and how to prepare them and handle them safely. To help the rural communities adopt healthy lifestyles, first we need to ensure that they have access to healthy foods. For example, fresh fruits and vegetables. Also, we need to make sure that these foods are available, that they are safe, and they are affordable to them. In addition, a major limitation for low-income and rural communities is nutrition and health literacy. In other words, nutrition educators need to make sure that the population they serve understand the information that they are providing them. There is also a need for regular health screenings in rural and low-income communities. This is very important so that we can address their health problems such as obesity, diabetes, and high blood pressure. By screening them regularly, this will help them understand their health problems and address them better. In addition, during these screenings, we could also provide information about healthy lifestyles and how to manage their health and also their diets.
I have several research projects that collaborated with many local community organizations and faculty across different departments at Texas State University. First one is East Lubbock Promise Neighborhood Grant Program. It's named Let's Cook, Eat, and Talk, which is the first community-based family nutrition cooking program. And the objective of this program was to improve healthy eating behavior by increasing consumption of fresh fruits and vegetables from regular diet. When we established this program, we had series of community-based needs assessment to find out real gaps and health issues in that specific community. Based on my research experience so far, I think there are several ways we can impact community through research activity. First one is providing research data to the community. In case of food environment study, our team provided pilot data to the local community meeting so that community leaders and community members can understand what is the real state of food environment in the community. I think as a researcher in higher education, we need to understand and work with the culture of the specific community. Without understanding and working with community culture, it is really hard to examine and explain why these communities have specific problems and how we can solve those problems.